Nick was always brilliant. He talked before he could walk, could recite the whole alphabet by 18 months, and taught himself how to read before he was 3. When he entered kindergarten, though, it soon became very clear that he was not like the other kids. He would scream and hit other kids at recess, and teachers had to say his name many times before he responds. At the request of the school's social worker, Nick's parents had him evaluated. When the results came back, they found out he has Asperger's syndrome. What in the world is that? They wondered. It is a pervasive developmental disorder, which means that every area of Nick's life would be impacted in one way or another. Chances are you may know someone with Asperger's syndrome, or perhaps you saw it mentioned in a book. Like Nick's parents, you may have wondered, what in the world is that? This presentation will help you gain insight. Asperger's syndrome was first described in 1944 by an Austrian pediatrician, Dr. Hans Asperger. He made his discovery independently, even though Leo Kanner was working on a similar set of symptoms in the United States. Asperger used the term autism when referring to his discovery, after the Greek word autos, meaning self, appropriate because many of Asperger's clients seemed lost in their own world. Because of World War II, though, it remained mostly unknown. In 1981, that changed. Asperger's paper was rediscovered and translated by a British researcher, Dr. Laura Wing. She also compared Asperger's syndrome to high-functioning autism, raising the question, are autism and Asperger's two separate disorders? I personally feel that they are one and the same, but the Diagnostic and Statistical Manual of Mental Disorders recognizes these as two separate disorders. According to Susan Ashley, there are no clear differences between Asperger's and high-functioning autism. The new normal saw Asperger's as a type of autism. Boys are far more likely to have Asperger's syndrome than girls. But if a girl does have Asperger's, it will likely be more severe. According to the new normal, ritualistic and obsessive tendencies and an apparent lack of empathy are characteristics of Asperger's. Things are not always as they appear, though. Susan Ashley said that people with Asperger's also have problems with coordination and social skills. Many of these symptoms will remain into adulthood, even repetitive behaviors, like flapping their hands. This can cause problems with depression and anxiety, as these people become painfully aware of their differences, usually during their adolescent years. There are 12 symptoms that evaluators look for. 6 are needed to diagnose Asperger's. These are grouped into 3 broad areas: deficits in reciprocal social interaction, in which 2 are needed; deficits in communication, none are needed here, although usually there is some; and at least 1 needed in the repetitive behavior section. Remember to treat the person and not the diagnosis, for there are 924 different combinations of symptoms. You may be thinking, okay, but what if I have Asperger's? Or what if I think my kid does? What then? The diagnosis should be made by a psychologist or other professional who has expertise in diagnosing Asperger's syndrome. No single test can tell whether or not a person has Asperger's. but some tests can be used as aids and to rule out other causes for their behavior. An evaluator will observe the person, review their records, and use questionnaires to obtain detailed histories of symptoms. A medical exam should also be done because, for reasons not yet understood, neurological and other problems have been associated with Asperger's. Asperger's syndrome may be genetic, for it seems to run in families, but no gene has been found. There is no cure and no type of medication can treat it, although medication can be used to treat coexisting disorders. No one can overcome Asperger's, and it lasts a lifetime. But there are interventions that can help with the unpleasant symptoms. These can vary from person to person. According to the new normal, David treated himself. He used lots and lots of notes to remind him of what to do and what not to do. These became a book, the Journal of Best Practices. Some people with Asperger's syndrome may completely miss the social cues that many others may take for granted. If someone is uncomfortable with them, they will not even notice it. Dr. Asperger once noted that his clients could be very smart intellectually, but retarded when it came to everyday living. Many of his clients could not dress or feed themselves, but one of them was doing cubic root calculations in kindergarten. This means the person may experience the most anxiety at home. Communication can be especially difficult for people with Asperger's syndrome. Usually it is a lack of communication because they cannot start or sustain a conversation. And when they do communicate, they use words in unusual ways. Echolalia, or repeating what others say, is also common. Decision making is also very hard. People with Asperger's syndrome may become very anxious because they may make a mistake. When they do make a mistake, they will rarely accept responsibility for it, and it may seem they never see the need to apologize, even though they beat themselves up over the mistake. They also have a hard time planning ahead. They may think of an unexpected or unusual event and even a way to minimize its effects, but will not put the plan into effect, instead relying on blind hope that the event will not happen in some cases. A good example would be normal people will start big projects early, so to allow time for research instead of rushing and perhaps missing something. A person with Asperger's will procrastinate and do it at the last minute, even though they have already thought that they could miss something or that it was completely useless tactic for them. Flapping their hands is also a problem because when they are caught, they can become very agitated and upset. They become upset because when they are flapping their hands, they are thinking of unlikely scenarios, like flying on a plane of their own design or running at very fast speeds. Although we all have these thoughts at times, normal people have no outward appearance that they are thinking these, and the thoughts remain private. But when a person who has Asperger's syndrome has these thoughts, everyone sees them, knows it, and the people can become very upset, especially when they are questioned about their thoughts. They know the thoughts are immature or irrelevant, and they don't like it that others know about these thoughts. The thoughts are ultimately seen as a mistake, so they will flap their hands when they think no one is watching. According to Wendy Lawson, Many people with Asperger syndrome will retreat to their own world to feel safe. They may think that this will help, but it doesn't. It only leads to loneliness and depression. But behaviors can also be used in positive ways. Persons who insist that the routine remain the same at all times are likely to be very dependable employees who always show up for work on time. Persons who pay attention to the parts of objects can be very detailed workers who are very accurate when completing tasks. And persons with Asperger syndrome may also have a great memory for specific facts and can repeat motor movements exactly. All of these can be advantages if used correctly. Parents of an Asperger's child will need to plan for their child's employment long before they enter the labor force. Individuals with an individualized education program, or IEP, are entitled to a transition plan beginning at age 14. Interviewing can be a challenge because of some of the social deficits. This may mean it will take them a long time to find a job. Job coaches may be needed to help with some of the challenging behaviors once they have a job, and disclosure may also be a concern. There are some historical figures who may have had Asperger's syndrome. Isaac Newton and Albert Einstein are both thought to have Asperger's syndrome. Bill Gates is thought to have Asperger's syndrome now. There are many challenges to Asperger's syndrome, but there are also many strengths. An Asperger's diagnosis is not to be feared. Any person can do anything they have put their mind to, whether they have Asperger's or not. Here are my references in APA format. And this is a works cited in MLA format.